The Community Foundation of the Mahoning Valley has released its 2021 year-in-review report detailing the impact it made through $2.2 million in investment grants. Here to discuss is Foundation President Shari Harrell. Well, Shari, thank you very much for being here. Could you start off by just giving us a little bit of a recap of 2021, what the Community Foundation did in 2021?
2021 was a big year for us in terms of getting things going again. I think we learned a lot through the pandemic. So there's been a shift in our grant cycles and how many opportunities folks have to submit applications for those. We implemented new software. We hired 2 new staff people to help expand our capacity. We completed an equity footprint assessment. So that was looking at all of our operations through a racial equity lens, not just our grant making, but our operations, our investments, everything we do. And the results of those reports are going to inform our strategic plan that we're working on right now going forward. We also awarded, between the Community Foundation and the supporting organizations, about $3.3 million in grants.
Okay. I thought I saw in there $2.2 million in investment grants?
That was from the Community Foundation assets, the funds held there.
Gotcha.
And the other $1.1 million was the supporting organizations that are affiliated with us. Western Reserve Health Foundation, Trumbull Memorial Health Foundation, and the William Swanston Charitable Fund.
Gotcha. Okay. Just wanted to make sure we had that clear so that we're accurate. Well, could you give us, just for somebody who may not be familiar, just a little overview of the Community Foundation and what it is you're doing, kind of what your mission is?
So our mission is, there's like 3 primary functions. One is anchoring assets locally. So pulling in charitable assets from individuals and organizations that have a philanthropic interest and keeping them place-based, keeping them local.
Okay.
Investing back in the community through a grant-making program. So I think that's how most people know us, is through the grant making, right? And the third part is our community leadership, engaging with other individuals and organizations across the community to address those bigger systemic issues. So one of the results of that would be the Healthy Community Partnership and the work that that group is doing. Okay,
and we'll talk about them in a minute. So I guess, what are some of the key areas, maybe some of the key challenges that you're looking to address in the Mahoning Valley?
There are several things. The Community Foundation itself is kind of a mixed bag, right? We don't have one central focus.
Right.
Because we have so many charitable funds with specific purposes and donor advisors who are still engaged that have all their general interest. So we do a little bit of everything, from arts to education to health to community improvement.
Right.
It's across the board.
And we'll see that when we go through some of the programs.
Right. But one of the things I think that we are really focused on is, how do we do it more equitably? That racial equity lens that we're talking about. How do we make sure that those smaller nonprofits, those boots on the ground that are really working in the communities that need the most investment, have historically been underinvested, have an opportunity to have access to the dollars in the same way? Typically, they're smaller staffs. They don't have a development team. They don't have a grant writer, right? And so competing with those larger organizations that have all of that, frequently, I think, philanthropy in general kind of directs the dollars to those that are well written, meeting all the specs. And so we're really working on reaching out and working with those organizations to make the process easier and to provide them the support they need to get the information out that we need to have. In terms of streamlining the process for the Community Foundation, we did try to simplify the application. Our new software has made the process easier.
Okay,
right?
Good.
But there is still information that we need that is easier to pull together with a larger staff, right? And so that's part of what we're working on. So one of the things that part of the team is working on right now is, how can we provide some capacity building opportunities for those smaller nonprofits so that they understand very clearly what it is we're looking for in the questions we ask. How to put a budget together that shows what we need to see when we're going to promote a grant request to donor advisors, and so on and so forth. So that's something that'll be coming in 2022.
Okay, very good. Well, let's talk about some of the programs, some of the highlights of 2021. So we talked a little bit about it, the Kent State Prison Education Pilot Program, which I think is very interesting. Do you want to talk a little bit about what that is?
Right, and that's what I was saying before, where Kent State has partnered with Sinclair Community College that was already involved in the prison system. Right.
This is the Trumbull Correctional Institution, right?
And the pilot that they're doing right now is in the Trumbull Correctional Institute. And they are working with students there, people interested in getting their bachelor's degree.
Right.
So we're waiting for the final report on how things went with enrollment and what they're anticipating in the coming year, but we're really excited about that opportunity because that's a very unique approach. And so many of the folks incarcerated there, right, if they're going to have a chance when they get out,
right,
they need that education, and many of the folks incarcerated there are from our Valley area.
Right. Let's talk a little bit about the Universal Scholarship Application. You gave out close to 400 scholarships last year. Do you want to talk a little bit about that and who that benefits?
Right. So that benefits students from the Mahoning Valley. We have a number of scholarship funds that we hold under our umbrella. And the Universal Scholarship Application is something that I think is really kind of a cool addition, and it just went into effect in 2021. So when a student gets on to our website to complete the scholarship application form, there's a series of questions that they're asked, and they fill out that application completely based on all the questions that they get. They will then be, even if they got on to, say it's a Warren City Schools student, and they got on to apply for the Warren City Schools Foundation Scholarship, if they qualify for any of the other scholarships under our umbrella, they'll automatically be considered for those as well.
Okay.
So they don't have to submit multiple applications. They don't have to figure out what they're qualified, what they may or may not be qualified for.
It's universal.
It's universal.
Right.
Right. And so I think that's a really unique feature and something that gives the students easier access to more opportunities.
So I know the William Swanson Charitable Foundation, one of their big ones that was highlighted in your report was the Alta Head Start Nutrition Program.
Yes.
Okay. You want to tell us a little bit about that?
Sure. So this aligns with our focus on the Healthy Community Partnership and health improvement, and for Swanston, the focus on youth, right? Those children that are most at risk or have the most obstacles to access to healthy foods, right? And so this at a very early age increases their exposure to a variety of fruits and vegetables and other fresh and healthy foods. They work with the families also to share information and share food. So it's something that really helps from the early stages. Right?
So as I understand it, they get at least one meal of healthy fruits and vegetables a week. They also get a lesson on the benefits of doing that and how to eat better.
And they're exposed to different things, right? So not just like typical carrots and apples, right? But more unique fruits and vegetables that they may not be aware of, and how to use them, and how to, how they can be a part of a well-balanced diet.
Yeah, see, I do that all the time. Like, I make a point to cook with my daughter, and she likes it. You know what I mean? I'm letting her handle the knife and everything. You know what I mean? But she's more engaged with what she eats now.
Yeah, right.
You know what I mean? She takes a little bit of ownership over it, and she can, like look at the meal and like identify the different parts and where they came from and how we cooked each individual one. So I think that is important. Yeah. The Western Reserve Health Foundation had the minority vaccination program, which obviously was important this year.
Right. So there was a committee formed to really work and do outreach to the minority community on the vaccine and the value of the vaccine and the benefits of the vaccine. And so they were looking for funding to support their efforts in terms of providing transportation, publicity, and all of that. And that was one of the things that the Western Reserve Health Foundation helped to fund.
And the Trumbull Memorial Health Foundation, obviously, is funding the Healthy Community Partnership.
Yes.
So for somebody who may not be familiar with the Healthy Community Partnership, could you talk a little bit about what that is and kind of the concept and what they're doing?
Sure. So the Healthy Community Partnership is a multi-sector collaborative focused on improving health and well-being across the Valley.
Yes.
All three of those supporting organizations that you mentioned are funders of the effort there. And it pulls together over 100 individuals and 70 different organizations that work together to address what are called the social determinants of health. So we know that health,
what you eat, how active you are, things like that.
Right.
Okay.
And it's really place-based, right? So where you live has a direct impact on your health and well-being, your life expectancy. For example, the one we always use, there's more than a 20-year difference in life expectancy if you live on the north side of Youngstown as compared to Canfield.
Right.
That shouldn't be.
Right.
Right? So how do we increase opportunities for access for fresh, healthy, affordable foods? Make it easy for people to get that, to understand that, to access that. How do we encourage active transportation and not relying just on cars? How do we make neighborhoods safe? How do we have parks and green spaces everywhere that they're needed, right? So those are the kinds of things that this group is working on to really focus on health equity. And we know through the pandemic that really came to light, right? We knew from our research that this in fact was the case. The disproportionate impact of COVID and the whole pandemic on low income and communities of color has really just made it a real time issue that people can say, okay, wait a minute. Everybody from Fauci across the country was talking about social determinants of health and place and geography and all of that thing. So that's really what they're talking about. So they look at advocacy, how do we encourage healthy policies, as well as programs and services that can address some of those immediate needs.
I was going to say that's a lot because you are talking about building sidewalks. You are talking about the layout of communities. You're talking about how many lanes should this road be? Should we change how many lanes that road is? There are a lot of jurisdictions involved. There are, you're talking about access to food. You're talking about, it's a lot.
It's a lot.
Yeah.
It's a lot. It's a little crazy, but but it's great. So what we see are small things. Boardman's doing great work around thinking about active transportation and how do we build our streets, our cities, our municipalities in a way that support automobile traffic, but also mass transit and pedestrians and bicycles safely. Right? Because if you look around so many of the parking lots, like you can't even walk across a parking lot in many of the plaza areas or store areas because it's crazy cars, right? So how do you think about that? So Warren City, for example, just recently adopted an active transportation plan. So when they look at resurfacing roads, they're going to be considering all that.
Yeah.
And so that's the kind of policy you want the jurisdictions to start looking at and thinking about, so that they're thinking about things holistically and the impact on people's health.
You can read the full report at the Community Foundation's website, cfmv.org.
717 Credit Union. Business services designed to meet your daily needs. Commercial loans, business deposits, merchant and payroll services. 717 Credit Union. It's knowing you were treated right every time.